Hi everyone, welcome to another episode of The Good Doctor. Today I'm here with Dr. Ahmed Al-Jazawi and we are going to be talking about veneers. What are veneers? We've heard it, we've seen it in Hollywood, a lot of celebrities wear it, but what is it? How do people get it? Is it permanent? We're going to have that conversation for our audience.
So veneers are thin layers placed on the tooth surface. Usually people do veneers for two reasons. Reason one is to have an aesthetic look. The other thing is in case there is damages on the enamel of the tooth, tooth surface. There is different veneers materials. You can use porcelain or you can use composite, and also different prices, different price categories. If you decide to go to a dentist, first of all, planning is very important. Your dentist should do a good planning for you. He should try to do some wax up models for you to show you exactly how it could look like.
So this is the question. I mean, you see some people, that they've had veneers because the mouth section of their face just looks glowing white, but there's also a bit of a gap, or we can say there's a bit of an extrusion. It just doesn't look aesthetically correct. What went wrong? I mean,
Well, this is what I mean. This is what I mean with a good planning.
Right.
It's sometimes some patients go to a dentist and he asks him for veneers, but he's very afraid of having some preparation on his teeth.
Right.
And in that case, the dentist will say, okay, I'll do that for you. And he takes an impression, he puts the veneers. The thing which we need to recognize and which need to take in the whole treatment is sometimes if you put a layer on the tooth, or if you put it on the teeth, and you'll have like something unnatural, because it will be like you'll have
it looks bigger. Odd. It looks weird.
Looks odd, exactly. So this is very important. This is what from the beginning I mentioned the word planning. It should be planned well. You should make a good planning for his profile. The profile is very important to do to veneers.
So how do you do that? I mean, do you take a picture of this person?
Well,
do you take a side picture?
I need to take pictures at the beginning, and with these side pictures, I need to have some measurements done to see how far I can go with the veneers.
Oh, that's a good point.
This is very important, and the patient should be informed. He should be informed from the beginning in case it is possible to do veneers without preparation, or is it possible to do it with preparation?
So you're going to shave off a layer of the outside, the enamel of the tooth.
Exactly.
Does that make the tooth more vulnerable and sensitive to decay? And so that's the first part of the question. The second part of the question is, if we do put a veneer on, does the veneer act as a protective layer, therefore prolonging the decay of the tooth?
Exactly. This is you already answered the question when you're in your second question. So the thing is, if you put a veneer, if you remove a part of the teeth, it should be covered.
Right.
And with this veneer, you cover the tooth.
Right.
So it's gonna be covered against decay or anything else. It depends also on how good the veneers were done.
Now, does this also mean that we don't have to brush our teeth anymore?
No, for sure not.
Okay, so we will have to still brush our teeth, make sure the veneers or that layer on the outside is clean and polished. And that's how you get bright and white teeth. I have a final question for you. Why is it that some doctors suggest that you either have the bottoms veneers or just top veneers? What's the recommendation for you?
Well, it's a matter of aesthetic at the end. It depends on your smile. There is people, when they smile, you see the upper teeth.
Got it.
So other people, you see more the lower. So it depends on the smile. And this is also, as I told you, something which should be discussed at the beginning. And with the measurements the doctor done, with the profile measurements and pictures he takes with the temporaries, he will sure know what kind of veneers the patient requires.
Okay. Well, there you go. There's the conversation about veneers. If you are planning on getting them, come in, have a consultation with your doctor, make sure you've got the planning in place. It is going to affect your look, your overall look. It is going to have an impact on the way you smile at the world. And please make sure if you have any comments or thoughts about this, leave them down below, and Dr. Ahmed will be happy to reply. Thanks for watching The Good Doctor, and we'll talk to you next time.